My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct, and in this FAQ Friday video, I'm going to answer the question, what is a Medicare Advantage Plan? And things you should know about it. So the first thing you need to understand about a Medicare Advantage Plan is it is not a Medicare Supplement Plan. It is not one of those lettered plans that Medicare is your primary and pays the bills that Medicare would charge you. That is a Medicare Supplement. A Medicare Advantage Plan is a private alternative to Medicare. So if you choose a Medicare Advantage Plan, also referred to as Medicare Part C, it is going to work instead of your Medicare Part A and B. Now you're still a Medicare beneficiary, but you're not going to use your Medicare card. You're going to use the card that your Advantage Plan carrier provides to you. So I'll give you a couple of examples of how that works. If somebody is on Medicare and they go to the hospital, Medicare charges what's called a Part A deductible, which this year is $1,340. Well, if you have an Advantage plan, it's not going to pay that $1,340 for you. Instead, it's going to replace that charge with what your carrier is charging you, which you have a summary of benefits that they have to disclose to you before you choose that plan. I think the nation average right now is probably about $300 per day in the hospital, each day, days 1 through 7. So comparing Medicare to an Advantage plan, if you go to the hospital, Medicare would charge you $1,340. If you have an Advantage plan, they would charge you, on average, about $300 each day you're in, admitted through day 7. So comparing Medicare Advantage to Medicare in a hospital, if you're in the hospital for, let's say, 3 days, Medicare is going to still charge you that full $1,340 deductible, to where your Advantage plan is going to charge you $300 a day times 3 days, so you would have a $900 charge, which in that situation would be less expensive than what Medicare charged you. However, let's say you're in the hospital for 5-6 days, let's say 5 days. Well, now you're going to pay, if you have an Advantage plan, $1,500 for that visit. Instead, if you have Medicare, you would have just paid $1,340. So it's not necessarily better or worse, it's just different. Another example comparing an Advantage to Medicare is, let's say you get an outpatient procedure. Well, with Medicare, A and B, you would have a very small $183 deductible, and then Medicare pays 80%, and you would pay 20%. Well, with the Advantage plan, again, it replaces what Medicare would charge with their own fee schedule, which you should be aware of if you choose that plan. And if you, let's say you get a knee replacement, you might have to pay 20% of that up to a max out of pocket, or you might have a set copay of maybe $400 or $800, whatever your summary of benefits or fee schedule would allow that carrier to charge you. An Advantage plan also is a network-based plan. So that means you have an HMO or a PPO. If you compare that to Medicare, Medicare does not have a network. Medicare essentially is its own network. It's a national plan, national coverage. So you have the same plan in all 50 states with Medicare A and B. With a Medicare Advantage plan, you can't just go to any doctor or hospital that you want to go to. You have to go to one that's in their network, whether it's an HMO, meaning you have one set of doctors you can go into, or a PPO, meaning you have 2 sets of doctors or hospitals, a set that's in network, or you pay a little more to go out of network. Okay, so with an Advantage plan, you have a network, HMO or PPO. Compared to Medicare, you can go anywhere you want in the country as long as they take Medicare, which is the largest network in the country. Also, what you should know about a Medicare Advantage plan is the benefits are not nationally standardized. They're not the same. Each county has their own set of benefits, and each plan in each county has their own set of benefits. So if you have a friend that lives in Florida, for example, and they have a Humana plan, and they tell you, oh, if I go to the hospital, it's only $195 a day, each day. I only pay $150 for cataract surgery. They might have a very strong, nice Humana Advantage plan, which is great. But if you live in, let's say, Nevada or Texas or somewhere else, that does not mean you have that same Humana Advantage plan. You might have Humana, and it might be an HMO, but it's going to have a different set of benefits. Still probably fine, but it's not going to be the same. So Humana plan in Florida is going to be different than a Humana plan anywhere else. Each benefit package is set up by usually zip code, maybe county, sometimes tri-county. If you're, for like example, if you're in the Tampa Bay area, you're going to have, Hillsborough, Pinellas, Pasco County might have the same benefit structure for each Medicare Advantage provider. So the main concept there is, just because your friend might have a Humana plan in Arizona and you live in, let's say, Ohio, you can't assume it's going to be the same Humana plan, because they're going to be different. And that's with all the carriers. Humana is a great Advantage plan provider, so I'm not picking on them. But if you have a United Healthcare plan in Montana, it's going to be a different plan than a United Healthcare Advantage plan in Arizona. Okay, so an Advantage plan's benefits are specific to that county or coverage area. Something else you should know about a Medicare Advantage plan is, if you choose a Medicare Advantage plan and later you want to upgrade to a Medicare Supplement plan, you will have to medically qualify to do so. Most people do not know that. You'd be surprised during annual enrollment how often our agents and I are talking to somebody and they'll say, yeah, I've got an Advantage plan, but I've had it for a few years. I had a bad year health-wise, so I had to use it quite a bit. And yes, it has a max out of pocket, but it's $10,000 and I met that this year. So I'd like to go ahead and pay for a Medicare Supplement plan so I don't have to worry about those things. Well, that's fine, except you're going to have to medically qualify to get a supplement. The only time you're automatically approved for a supplement plan is when you first turn 65 or you're first new to Medicare Part B. After that period, you have to medically qualify for a supplement. And I think you'd be surprised at how many people do not know that, and how many people, when they finally want to go to get a supplement, they didn't know that, and then they get stuck in the Advantage plan realm of plans until their health stabilizes for 2 to 5 years, and then they can get a supplement. So it's very important that you understand that. And those are really the main things about Medicare Advantage plans I think you should understand. They're network-based, so you're going to have an HMO PPO. Their benefits are county or tri-county based typically, meaning the plan benefits are different based on the county you live in. They're not standardized nationally. And if you have a Medicare Advantage plan and you later want to upgrade to a supplement plan, you will have to medically qualify to do so. If you have any questions about Advantage plans, listen, we offer both. We offer Medicare Advantage, we offer Medicare Supplement plans. There's not necessarily a right or wrong. I'm just a big advocate on know the difference, understand the difference, and understand the pros and cons to both. Because there is no perfect Medicare plan. For somebody, a Medicare Advantage is the perfect plan for them. For some people, a Medicare Supplement plan is the perfect plan for them. I just think it's really important that we understand the differences and you make an educated choice for yourself, not just now, but you understand the impact it's going to have on you as you get older and your health might change. So if you have any questions about Medicare Advantage or Medicare in general, just go ahead and leave a comment here on YouTube or Facebook. Please like and share this video with your friends. You would be surprised at how people really don't fully understand what a Medicare Advantage plan is. So please share this so that everybody can learn. Because again, if you watch all my videos, I've got hundreds online. I'm a very big advocate for education. I think that if you're educated, you can make a choice for you. And then our job is to help educate you. You make the right choice for you, and then we give you carrier options so we get you the best value for the choice you made. So if you have any questions, leave a comment, like, share this video, and thanks for tuning in. Have a great Friday, everyone.